Okay, so the first thing we're going to do for sterile field glove application and the suturing competency is to go ahead and draw up our local anesthetic. So we're going to use our fake anesthetic. I'll go ahead and take off our top, get your alcohol swab. Remember to rip it down the middle so the alcohol swab pops right out, and then you can go ahead and clean the top. At this point, go ahead and put your non-sterile gloves on, prep your wound, and then go ahead and examine your wound. So let's go ahead and draw up our anesthetic. So this is my 25 gauge needle. I'm just gonna open it and drop it onto the field. My 18 gauge needle. Open that one up, drop it onto the field. And then my syringe. All right, so remember I should have my non-sterile gloves on. I'm gonna go ahead and drop 1 cc of anesthetic. So I pulled back 1 cc of air, inject the 1 cc, and then I'm gonna pull back and get 1 cc. Okay. Drop my needles. Okay. All right, make sure you inspect your needle, bevel up, and this is going to be our direct infiltration. So at this point, we're going to go inside our incision, and we're going to go in to the corner, and then follow along the inside. On one side, aspirate, inject, pull back as you inject. And then moving up where you anesthetized, you're going to just go right in there, advance the needle, aspirate, no blood return, you're going to pull back, and as you pull back, you're going to inject. Now, I am not injecting as I go because I don't want to ruin the skin, but we're going to follow this all the way around. We're going to just keep going in, aspirate, inject as you pull back, all the way to the tip, and then we're going to do the same thing on this side. And every time you put the needle in, it should already be an anesthetized area, so they should really only feel the needle sticks at the very tip here. All right, so the next part, we're gonna go ahead and open up our sterile field. So we have our patient here. We're gonna open up our sterile field near the patient, next to it. Make sure that you turn this away from you so that you're gonna go ahead and open up the furthest point away from you first so that you are not leaning over that sterile field. And then we're gonna open up the side, the other side. We can go ahead and turn this, and then the last part at the corner. All right, so the next part, we're gonna go ahead and open up some of our contents onto our sterile field. So this typically would be in a wrapper like this. This is my irrigation. I'm gonna demonstrate with the smaller syringe. I'm gonna open up my smaller syringe without touching anything on the inside. I'm gonna drop it into my bowl. Same thing with my suture. I'm gonna open up my suture, drop it in my bowl, and then the same thing with my fenestrated drape. So, open up my fenestrated drape, drop it into my bowl. Okay, and it's okay if it doesn't make it in as long as it doesn't go past that 1-inch border, so we're good. All right, next part, we're gonna go ahead and do our sterile gloves. So this is already open, you can touch that. We're gonna open this, make sure you crease it. We're gonna put one glove on first at a time. I'm gonna just twist this so it doesn't touch my sterile field. So I put my left on, again, dominant hand is typically done first. So my one glove, I'm gonna walk over to my sterile field. I'm gonna go ahead and take the contents of my sterile field out. And then I'm gonna go ahead using my non-gloved hand, screw off the cap, pour it into my bowl for my irrigation, put that there. And I'm gonna walk back. Technically in real life, you could probably put your gloves up here, but my table is too short. So I'm gonna walk back over here and get my other glove on. All right, so now I have my gloves on, and we're gonna come back over here. All right, so now that I'm sterile, I'm gonna go ahead and maneuver my items around, being careful not to go past my edge or lean over my field. I also keep my hands in front of me, don't touch my stomach, don't let them dangle beside me, because I don't wanna break sterility. So go ahead and I'm gonna move these things around. Okay. Maneuver my instruments, go ahead and draw out my irrigation solution, get some gauze ready. First thing I'm going to go ahead and do, because this area has already been prepped, being careful to only touch the prepped area of the wound of the body, because I am now sterile. I'm going to go ahead in here and I'm going to irrigate the area. So irrigate, irrigate, irrigate. I'm not going to actually do it because I don't want to ruin the skin. Go ahead and dry it up. The other thing you're going to do before you drape is just to assess it to see if you need to do any undermining, to see how you need to approximate the wound edges. If everything looks good, we're going to then go ahead and move on to draping the area. So I'm going to go ahead and open up my drape. Okay, I'm going to go ahead and lay it the same way as the rest of my sterile field, just to keep it nice approximation of the edges. I'm going to go ahead and suture. So I'm going to go ahead and take my silk braided suture here. Again, for just like we learned in class, typically for simple lacerations of the extremities, we are doing nylon, not silk, but I'm using silk temporarily. Oop, let's throw away that. All right, and this like knotted. There we go. Okay. All right, so let's go ahead and load up my needle driver. Now I have an extension of my sterile field, so I can let this lay here. I'm going to do a simple interrupted suture, just for demonstration purposes. Remember, for the comp, it could be one of four. You get the simple interrupted, and then it could either be running, it can be vertical mattress, horizontal mattress, or the simple interrupted. So 2 loops for the first one. Make sure you're pulling it nice and snug. Go ahead and cut. Doing a tail. And then I'm going to go ahead and quickly demonstrate how you take it out. I'm going to go ahead and grab it by the knot. Right underneath where the knot is, I'm going to go ahead and put the scissors in, cut, and pull right out. And that's go ahead how I remove it. And that's it for this competency.